We're talking about the odds of a child getting permanently damaged by exposure to lead.
This is an enormous community problem.
Utica has one of the highest lead poisoning rates in the state of New York. New York is one of the highest in the country, and therefore we have one of the highest rates of lead poisoning in the United States.
When you look at a problem that is as dynamic and multifaceted as lead, how it affects the health of a child, the family, the home, the neighborhood, and then the community at large, there are so many layers.
But the reality is, no matter how much money we were spending on economic development, if you continue to have a poisoning rate as high as like upwards around 30% of your newborns on a given year, you're not going to have a capacity to go anywhere.
That's 1 in 3 children that are facing this issue.
But by the time kids become really toxic in lead, and if they're over 6 years old, the damage is done.
That person is going to have some IQ loss. That person is going to have some developmental delays. That person is going to be more susceptible to making poor choices versus good choices.
These are all things that we could prevent if we can adequately screen kids for lead, and we can get them appropriately treated and prevent further intoxication.
They said, figure this out. You have 3 years and $1 million and go fight lead.
The coalition is made up of about 40 organizations. We all want to see our population be happier and healthier.
This can't be done alone.
The coalition was finally able to pull all the people together who were affected by this issue, but also pull them together in a way where we could start to collaborate and talk about, if I do this and you do that, we can do this. Pulling in all the different funding streams, removing the barriers from these silos of funding and these organizational silos is critical.
MVHS took a leadership position of how do we help our community? And by providing support, which includes my time and others, to do educational work, to work with the coalition, to help educate our own physicians and nurse practitioners, it really helps to foster the mission of how do we improve the health of our community. MVHS is involved because we need and want to improve the quality and the health care of our community. Through the point of care testing, a machine called LeadCare 2, you're able to collect a sample right at the time of the visit from a finger stick. And you can run that test and get a result in a few minutes. The parent is here with you, with the child when they're being seen. You can educate them about the potential for lead poisoning, and you can get the test done right then and have a result. You have to look at what are the other elements that need to be taken care of. And it's not just the medical. It is actually housing, environment, safe housing, green and healthy homes.
So most people think that children eat paint chips, and that's not how they typically get poisoned.
The lead dust from just opening and closing windows that can get on the window seals, can get on the carpets, can get on the floor. Your child is crawling or pulling themselves up or walking is enough to lead poison a child.
When we talk about lead hazard prevention methods or interventions, we're really talking about housing rehabilitation and construction. Not only does that, provide a better and safe environment for children, it improves the neighborhood. It improves the aesthetics of the neighborhood. It improves quality of life in a neighborhood. It improves the value of homes and values of properties, and all of those contribute to a larger society.
That's one thing the coalition has been able to do. Bring people from very different backgrounds, different functions, different areas of knowledge, and share that to everyone's benefit.
I think those collaborations are key because you really do need to approach this issue from all angles.
I think anytime that we're able to go in and cure the lead hazards where there's a lead poisoned child in the home, for us that's success, knowing that child's now going to live in a safe, healthy house.
How do we rebuild our community so that it is healthy, that there is prosperity, that there is opportunity?
Moving the needle on an entire population is really difficult, but going into a single household with young children and knowing that they are going to be in a safe, healthy environment is heartwarming. And you know that they're going to have the best chance they need.